Thank you for joining us for this Fox 43 News special report. I'm Jackie DeTore. We are breaking into programming to bring you an update from the Pennsylvania Department of Health leaders about the COVID-19 strain of coronavirus. About an hour and a half ago, we learned there are now 11 people with presumed positive cases of COVID-19. 4 of those patients are in the hospital. 7 of them are at home under quarantine. The newest patient is from Montgomery County. 7 other patients are also from there. There is also 1 patient each in Delaware, Monroe, and Wayne counties. Meanwhile, all major health insurance companies in Pennsylvania will cover coronavirus testing. On Monday, Governor Tom Wolf announced that insurers which provide comprehensive medical coverage in Pennsylvania will cover medically appropriate COVID-19 tests and treatment. Labs will now bill insurance companies for the coronavirus test, just like any other test. Until now, testing was only being done at the CDC or state labs using public money. And we do want to give you the latest update now. Dr. Rachel Levine, the Secretary of Health, is preparing to give us an update on the latest COVID-19 response in Pennsylvania.
To the 2019 novel coronavirus, or COVID-19. As of this afternoon, we have 11 Pennsylvanians who have tested presumptively positive for COVID-19. The latest case is a Montgomery County adult who is hospitalized at the University of Pennsylvania Hospital in Philadelphia. This case is a result of contact with another individual who tested presumptively positive. This brings the Montgomery County total to 8 presumptive positive cases. To update you on one of the cases we announced yesterday, the patient from Monroe County has been released from the hospital and is in isolation at home. There are no other changes to the other patients that we have described. Today, I wanted to go over some specific public health terms to make sure that we're all understanding each other and pretty much speaking the same language. I want to talk to you about the difference between self-isolation and quarantine. Isolation and quarantine help protect the public by preventing exposure to people who might have any contagious illness. In this case, we're talking about COVID-19. Isolation separates individuals that are sick with a contagious illness, in this case, COVID-19, from people who aren't sick. Isolation is usually voluntary, but in an emergency, the Pennsylvania Department of Health and the Secretary of Health has the authority to legally isolate people who are sick. Quarantine is a little different. Quarantine separates and restricts the movement of people who have been exposed to a contagious illness, such as COVID-19, to see if they become sick, so you can see the difference. If someone is in quarantine, they may not be sick, and they may not become sick. But a quarantine is very important because it separates those who were never exposed to stop the spread of disease. So that would be done during the period of time from their exposure and then see if they get sick. Quarantine can be voluntary, but in an emergency or a disease outbreak like this one for COVID-19, the Department of Health and the Secretary of Health does have the authority to require someone to be quarantined if they have come in contact with someone who has an infectious illness such as COVID-19. This would be during the possible incubation period. It's so important that everyone in Pennsylvania know that we are taking every precaution to keep our communities safe. If someone is sick with COVID-19, they are in isolation at home or at a hospital receiving medical care. If someone's in quarantine, that means they have been exposed to someone who has COVID-19 and they are at home to limit their exposure to the rest of the community. So I hope that explanation distinguishes these two terms, which is important as we proceed in our response to this outbreak. Now, To repeat what I had talked about yesterday, the most reliable information related to Pennsylvania's response is available on our website, health.pa.gov. We will continue to update our website and have the latest information, tips, and preparation lists. As this situation evolves, we will continually update Pennsylvanians through our website, our Facebook, our Twitter account, and regular press releases and press conferences. If you have questions about your health, please contact your healthcare provider. We have been updating healthcare providers regularly on how to assess patients and with information about how to obtain a test. What is most important is that everyone in Pennsylvania stay calm. The Pennsylvania Department of Health, under the governor's leadership, working with the administration, with other departments and agencies, with PEMA, of course, at our command center, have the networks in place to ensure that we will continue to have a healthy Pennsylvania for all. And now I'm available for questions.
Is this a case of community spread?
No. Community spread. So this patient has a known contact to someone else that we know is positive. Community spread, I know it's challenging. If it's a specific public health term, it has a specific definition, is when there is spread in the community. Someone gets COVID-19 and we have no idea how they got it. They didn't get it from travel, either to another country or travel to a place where we know there is COVID-19. They didn't get it from a known contact. They just present with symptoms and have COVID-19, and it was somewhere in the community. Dr. Watkins, is there another way that you could explain it?
So in this outbreak, we are still in the containment phase, which means we are really investigating every case, and we are trying to determine exactly where their exposure is. Was it from international travel? Was it from close contact with another case that we are aware of? In Pennsylvania, the most recent case had close contact with another case. So we can explain how they got sick. Community exposure is when the person presents and we really can't identify how they got sick, which means that if they weren't traveling internationally, if they weren't somewhere in another state, if they didn't have close contact with another case, they must have gotten it from virus circulating in the community that we haven't been testing or identifying, meaning that that individual didn't go to the physician and get tested, so they had contact with cases that are in the community that are unknown to public health or healthcare providers.
So it sounds like it would be accurate to say then that this person actually did become infected in the community of Pennsylvania, but it's not considered to be community spread for what you said, correct?
Exactly. It's a close contact. We're aware exactly how they became infected.
So I know that it can be challenging, but we're really trying to stick to the specific public health definition for these terms, which is one of the reasons we talked about the difference between isolation and quarantine. They all have very specific meanings.
Dr. Lippman, Germantown Academy today said that a student there had tested positive. Is this the 11th case?
We're not going over that specific information. This patient is an adult.
How might the public health response change? Because community spread is clearly an important term to you. How might the public health response change when we start to, or if we start to?
Sure. And so that would be when we shift from the containment that we're doing, as Dr. Watkins said, where we do contact tracing, and we're tracing where anybody might be exposed, where we are quarantining those patients, right? They maybe they're in the period of time, the incubation period. So if they've been exposed, we're quarantining them. Go back to my previous definition. And so we're doing that for anybody who turns positive. When we shift to it, certainly significant community spread or community transmission, we're going to shift to mitigation. Mitigation means that we would be doing a lot of work in a specific area. It doesn't necessarily have to be statewide to enforce social isolation. And that would be very different.
John, can you describe describe what you mean by close contact? Because you've seen news reports of members of Congress shaking hands with people and then isolating themselves. You know, what would people know about how close contact actually, what that actually means?
Sure. Close contact usually means a household member, or it could mean in an office setting you shared a cubicle, a very small cubicle with someone. It really means being within 6 feet of an individual and sustained contact, for example. But I would emphasize that we in public health explore, investigate the close contacts and really assign them risk based on talking it through, how long were you with the person, et cetera.
When you're talking about the difference between isolation and quarantine in your home, can you not go outside at all in your own yard? And when you're talking about the difference between self and mandatory, who's watching those people who are self-isolated or self-quarantined? How do we know they're really listening?
So, two things. In terms of going out in their backyard,
Sure.
yeah, they could do that. So if they have an enclosed backyard, they don't have to stay indoors. It's not going to travel from one yard, 100 feet to another yard. So, I mean, again, we recommend, a minimum of 3, really 6 feet separation. But if you're, 100 yards away, you're not going to get exposed. But they are supposed to stay at home. They're not supposed to go out and go shopping. They can't go out to the grocery store or to the pharmacy or whatever. And depending upon if they're a high risk, I mean, we know that they were exposed, then we check on them daily. I mean, we'll be making regular phone calls. We don't watch them 24/7, but there has been data actually in an article from the 2014 Ebola situation that people that are isolated, I mean, people who either isolate or quarantine, 98-99% of them follow directions.
Yeah, can you, in this case, since it was a person-to-person transmission, can you tell us anything about the setting or relationship of these two people?
They were close contacts.
Can you tell us whether they were co-workers?
No. Again, I know that people want this information. The information that we're trying to put out, if it has public health significance, so the relationship between those two people does not have public health significance, and they are entitled to privacy and confidentiality, and that's what our regulations state. So we are telling you about every positive case. We are telling you whatever is necessary to protect the public health. Otherwise, it really violates their privacy. Yes?
In Central PA, in Coma Hospital, we're hearing that there was an individual, a woman who came home from Italy. She wasn't feeling well. She was taken to Coma Hospital, and the TSA apparently at the airport was concerned about her last week. I know you haven't been speaking about.
We don't have. I mean, I wouldn't talk about a specific case, but we are in contact with our county municipal health departments, certainly with hospitals, and so if a hospital has a case or a potential case, someone they're concerned about, they will be calling us or their county muni and discussing those situations. We will recommend a course of action, such as potentially testing, and then we get the results. So I'm not going to be able to speak about that particular case or any particular case.
David, go ahead.
I appreciate the clarification regarding quarantine
Yeah.
and isolation. It sounds like, say last week when you announced the first 2 cases, there was a lot of talk of quarantine. It sounds like we should have been using the term isolation.
So the patients who are positive, the correct term is isolation, and if patients have been exposed, the correct term is quarantine. And we're trying to clarify, make sure that everyone's on the same page today.
Right, so now we have about 8 people who are in isolation right now.
Well, we have
Because
11 cases.
Yeah, and some are in the hospital.
Some are in the hospital.
No, I get you're right. They're in isolation, whether it's the hospital or at home.
That is correct.
They're in
If they're
isolation.
sick, they're in isolation in the hospital. If they're not very sick, they're in isolation at home.
Yeah, I mean, and we must have additional people who are quarantined.
That is
because of
correct.
Can you tell us how many are quarantined?
So any close contact to these patients would be quarantined.
And I'm just wondering, can't you tell us how many?
We're not.
Just a good barometer.
I understand. So we'll be continually discussing, the information that we release, and we want to make sure that we are sensitive to your requests and the public wants information, and we have to balance that versus the patient's need for privacy. What we don't want anything is that someone says, "Oh, I know that's Mrs. Smith on Jones Street," and that's unfair. It's just totally unfair.
I was also going to ask if you could say how many people, but I mean, for the people who, for us who are go out doing our jobs every day, we want to know if our neighbors are in quarantine, maybe we should go over to their house. I mean, how do we go about our daily lives not knowing if even our closest neighbors could be in quarantine?
Right, I understand. So if they're in quarantine, you won't be going over their house because you're not going to be able to, I mean, you.
How would I know?
I understand that, but they would not answer the door. I mean, so you can see if it was your neighbor. Then we worry about their privacy. So it is a balance, but they will not be greeting you and welcoming you into their home if they're in quarantine. And so, but we will continually be evaluating that.
Do you recommend people or have people who are self-quarantining, are they reaching out to the health department? Should they?
Well,
to let you know that they are
so most of the people who are in self-quarantine, we have quarantined, right? So, or the county municipal health department has said you've been exposed and you're quarantined. There are some travelers, some of the travel advice where we said that if you were had traveled from a specific country, that you should notify us or the county community health department and self-quarantine. Do you want to be able to expound?
Sure. We have listings of named individuals who are on quarantine based on their risk category. Either they've traveled from Iran or China, and we have close contacts who are on quarantine. They should be calling their healthcare provider and the health department if they become sick during quarantine. We've also asked travelers who've traveled to countries such as Italy or South Korea to let us know if they've become sick while they're isolating. And they should also call first before going to a healthcare provider.
Okay, I just have one quick follow-up, if I may. Dr. Levine, so you have schools that are closing down in the eastern part of the state because of a student or faculty member who is possibly exposed. Since we don't know who that is, if the students or teachers don't know who that is, how do they know if they came in contact with that individual, who came in contact? So at what point is it okay to just go about your daily life if you're in one of those affected areas?
So I think it is fine to, again, there is no known community spread. And so if you are a close contact of one of the patients, we are contacting you, or the Montgomery Health Department is contacting you. So we really want to reassure the public that we have no known community spread and you can go about your business. We understand about the school closures, and we'll be working really closely with the Pennsylvania Department of Education on that. Now, remember that we have a local control state, so a lot of counties and school superintendents will be making their own decisions, but we're going to make sure that PDE is in close contact with all of them.
Thank you. I also want to ask about schools. You know, yesterday listening to some school district leaders voice their concerns about when to close, cancel classes, or maybe when to just stop doing sporting events or public events. At what point would it make sense to do that? Because it seems like there's a real fine line where almost once it starts to get into a school, it might be sort of too late.
So that's one of the things that we're continually assessing, right? So we would work with the county municipal health department if they're in one of those, and then PDE would be working with the superintendent on all of those decisions. And so again, mitigation efforts, if we start to have community spread, will be much more significant. But in terms of one of these patients who are in quarantine, what we would like all the schools to do is to work with us, to work with the county municipal health department, PDE, to work with the superintendent, and all be on the same page. So we're going to be working to do that.
Just to make sure I understand you, is it fair to say then that a case of community spread would be sort of the watermark for considering the state recommending closure of schools in a region near where that?
Yeah, it might not be one case of community spread, but if we are seeing significant cases of community spread, we will be taking assertive mitigation efforts. Now, that would necessarily be statewide, right? So if there's a case in a certain area and another area is Allegheny, they're not at risk, right? It doesn't travel across the state like that. But in a certain area, we will be taking mitigation efforts, but we're not there.
Dr. Levine, thank you for taking my question.
Sure.
You may have noticed, like, for example, Penn State Harrisburg, they had a basketball game a few days ago, and I think their gym was empty with the exception of members of the media. I don't know if the Department of Health has a direct interaction with the PIAA, but as you probably know, there's a lot of basketball games coming up
Sure.
I mean, at what point, kind of follow up to what
Yeah.
this gentleman was saying, at what point do you have that conversation of maybe, not allowing fans in the game? Are we even close to that yet? And how
So
do
it's
you
hard
do
for
that?
me to tell you how close we are, but that's exactly what I'm talking about in terms of mitigation. And so we have not seen any community spread. So, I mean, different schools and universities are taking their own precautions, and that's fine. But the state with county municipal health departments would be taking more significant mitigation efforts if we start to see significant community spread, which we have not seen. And we don't know if we'll see, but we certainly haven't seen it yet. Yeah.
Could you, if possible, could you shed more light on what it would take to close schools? I mean, for a decision to be made that
Yeah.
closing schools is the best thing, because I ask that in the light now. I mean, I think as you read more about it, hear more about it, like, people are starting to think it through more, and they're starting to think about things like, say, some schools might really not have any capabilities for distance learning, or some kids
Yeah.
might not be in a situation where they have the technology at home. And then I think you even have, like, there's concern about, say, kids who rely on the school for meals. And it seems like there's even consideration of, well, and things about, like, well, who would care for the child and what impact
Yeah.
would that have? So, I mean, in light of all that, I mean, can you talk about, even if you think it's very likely that would ever become the wise
Sure.
thing for many school districts?
So I'm really not going to think about and guess what's going to be in the future in terms of likelihood, but all of those considerations that you just mentioned very, very concisely are all the things we have to take to think about. So we would be thinking about that. We would work with PDE to think about that. We would work with the county and the superintendent to be thinking about that. Of course, we work with the governor's office, and we're working with county commissioners and things. So we would need to collaborate and make the best informed decision to protect the public health. But you're right; it's a significant decision that has repercussions. So we'll only do it if absolutely necessary, but we would to protect the public health. But all of those factors have to be taken into consideration.
I'd like to just add one more thing then, because we've read about some of the districts that have closed down, and I don't want to pass judgment on them, and maybe there's things I don't know, but I would say some of them, it's really, it looks like it's the result of, say, an extreme abundance of caution. And it makes you wonder, like, are we going to see this start happening all over the place?
Yeah.
Do you have any thoughts on
Well,
that?
I'm all in favor of abundance of caution, and I'm not going to comment on any specific school or school district that decided to close, but we need to make a very, very informed, careful decision about incorporating all of those factors.
Where is that line between the abundance of caution and not telling people not to panic? And
Yes.
also we say don't go into work if you are not feeling well. Well, if it's just cold symptoms and I haven't been around anybody, can I go to work?
Well, so that fine line is where we are living now, right? So that is why we are in our incident command, why we have all of our collaborations both locally as well as in our state government, of course, the governor's office and the administration, why we're collaborating with other states, why we're collaborating with the CDC, because all of these decisions have ramifications, and everything is a balance, and it is absolutely that fine line or that razor's edge, which is where we are right now, and I can assure you that we are making the most informed decisions that we possibly can to protect the public health.
But when we do finally get that first case of community spread, is that going to be a tipping point?
I don't know if one case would be a tipping point, but certainly if we saw a number of cases or significant cases, that would be a tipping point, but we're not there.
Just would like to ask one question about money. We have this $8.3 billion federal emergency fund. School district leaders and other community and county leaders had good questions about how that might actually reach them. People have really clear things, expenses that they're going to incur, and also things that they need. And I think first of all, I think it's very important that we track every dollar that comes into Pennsylvania. Can you tell me, how they're going to be able to access that? And I'd actually like to follow that up though with a question about how that would extend to the individual person, because somebody's asked me, if they're uninsured, what might the state be able to do with the expenses that would come?
Sure.
From us? I think that question.
So I know that there was a press release yesterday, I believe, about insurance. And so in terms of insurance coverage, that insurance companies would be covering all testing. And we have, of course, Governor expanded Medicaid, which allowed 720,000 or more people to have access to Medicaid. We have one of the lowest uninsured case rates in the country. But we will be taking precautions for the uninsured. Again, our testing at the Pennsylvania Department of Health laboratory is completely free, so they don't get charged for that testing. I guess if they went, companies will cover it, but we'll have to work with uninsured individuals. But that testing through us would be free. In terms of the federal money, so we have not received a lot of specifics about the federal money. We're hoping that that will be available over the next number of weeks. And we're in constant discussion with the governor's office in terms of funding. But we are not sparing any effort right now because of money. I mean, in terms of all of our efforts at the command center, at PEMA, the county munis, I mean, we will work for resources for this public health response. And we're very grateful to the federal government for that money that will be coming down, but we don't know exactly how much that is and exactly when that's going to come, but it'll be, I mean, we'll have informed decisions to put that money to good use.
Okay. All right, thank you, Dr.
Thank you very much. Thank you very much. I appreciate it.
Dr. Rachel Levine. You have been watching and listening to her giving an update on the COVID-19 strain of coronavirus in Pennsylvania. We do just want to give you a quick update right now about what was mentioned. There are 11 presumed positive cases in the Commonwealth right now. We do know one person who was in the hospital has come home from the hospital. That person was in Monroe County. At this time, there are still 3 people in the hospital. Everyone else is at home. There are no cases of community spread right now. So that's when someone tests positive for COVID-19 and health officials don't know how that person was exposed. They say the new patient is in Montgomery County and the Department of Health knows how that patient was exposed. Again, all 11 cases are still presumed positive until the CDC can confirm those results. And here's just a direct quote to leave you with today that came from Dr. Rachel Levine. She said, quote, "What is most important is that everyone in Pennsylvania stay calm." And you can expect more on the coronavirus outbreak later this afternoon on Fox 43 News first at 4 and on Fox 43 News at 5. We'll take a look at how the virus is impacting cleaning services. Plus, we're answering some of your questions about symptoms and terminology about the virus. You can also expect more information about coronavirus on the all-new Fox 43 News app. If you have an iPhone, just head to the App Store and download it today. Android users, update the one you already have to see our brand new look. And thank you so much for joining us on this special report for the update on COVID-19 in Pennsylvania. I'm Jackie DeTore. We'll see you this afternoon at 4. We now return you to Family Feud.